So I was just saying, so this morning when I talked to you, the situation is that we have 250 Canadians which have registered on the website of Global Affairs Canada, which are in the province. Of the 250, we have 126 which have requested consular assistance for our assistance, obviously. And so we're looking now at contacting them. As you appreciate, it's the middle of the night in China. We are in contact with them. We're trying to contact everyone, assess their specific need for assisted repatriation. We're at the same time consulting with our allies and looking at the different options that people are considering, also in contact with the Chinese authority. But as I appreciate, because it's the middle of the night, this is the details I have for now. We're looking at all options to assist them. That's our priority, but we'll come back to you when I have more. At this point of time, this is the information that I have. I'll repeat with pleasure. So what I was saying is that, as we said this morning, the latest number that I have, because I think Canadians watching us should understand it's a dynamic situation. We encourage Canadians to register on the website because that's the best way for us to inform them as quickly as possible about recent developments. So what we have now, of the 250 Canadians who have registered, 126 have signified their wish for assisted repatriation. Because it's the middle of the night, we're trying to contact everyone to assess their each individual needs. We're looking also at options with different nations. As you know, different nations are looking at how they can repatriate these people back to their countries. That's the consultation we're doing right now. We're looking at all options to provide the best consular service we can. And we will come back to you as soon as I have more details, because you appreciate we just finished cabinet, we have that. I need to go back, make sure that I have the latest information so that we can come back to you in due course.
Are you talking about sending a plane or hitching rides?
Are these people that are in quarantine type areas, or they can't get out of the cities, or is it because they are sick that they're reaching out to you?
So maybe I can take that question. Quite frankly, we don't know yet what the situation of those individuals are. As Minister Champagne has indicated, that's part of the process, to reach into, to speak with the individuals, to find out what kinds of situations they're in, what their needs are, and and assess from that space what kinds of help we could provide. I will also say that part of the risk to travel to that area is not necessarily about contracting the coronavirus, but really, quite frankly, the strict quarantine the entire region is under. So, for example, people that are visiting to that region or traveling in that region may be having a hard time accessing supplies that they need. They may be having a hard time getting around the community. They may be having a hard time moving from one region to another. They may have family in other areas that are isolated. So this is the work that he will be doing with his team to assess exactly what kinds of supports the Canadians that are reaching out to us need. Right. So first of all, I spoke with Minister Dix earlier, my counterpart in British Columbia, and reviewed the case with him. The case is similar to Ontario in that the person traveled from Wuhan. He had no symptoms. When he arrived home, he began to feel ill, and he reached out to his healthcare provider. But given that he had undergone all of the information at the airport and knew what to do, he also advised his healthcare provider that he had recently visited Wuhan, which allowed the infectious disease protocol to be placed in the clinic that he visited. And now he's under isolation and being observed for further worsening of his condition. The national lab has not confirmed the case yet, but we are very confident in BC's lab.
Do you know yet if he was on the same flight as the people who were in Toronto, or is it completely different flights?
My understanding, it's a different flight. I will also say, to answer the question about quarantine and isolation, I spoke about this earlier, but I do want to be very clear that quarantine is only appropriate when people are asymptomatic, and right now there is no evidence that this disease is spread when people do not have symptoms. So isolation is a situation that occurs when people have the symptoms, and he is isolated.